My name is Dominique Sturz and I'm a patient advocate for Usher syndrome and rare eye diseases and rare diseases in general, and I'm based in Austria. And I'm also a mother of a young adult with Usher syndrome subtype 1. In the early 90s, I started as an ambassador and patient advocate for a bilateral early cochlear implantation, and then we got the diagnosis of retinitis pigmentosa in addition to deafness in 2005 into our family, which was genetically confirmed in 2012, USH1B. And since then, I've been advocating for early diagnosis of Usher syndrome and rare eye diseases, and I've been running the Usher Initiative Austria since 2012, 2013. I'm also founder and initiator of Usher Deafblind Austria, which is an organization focusing on deafblindness and disability advocacy in our country. And well, I'm also on board of the Austrian Rare Disease Alliance, Pro Rare Austria, and involved in rare disease strategies in our country and also on international level. And well, last but not least, I'm coordinator of the special interest group for Usher syndrome at Retina International. And I joined ERN-EYE a year ago in March 2018 as an ePAG, as a patient advocate. In the ERN-EYE, I'm assigned to the work groups Pediatrics and Education and Training, which fits perfectly into my personal original mission to advocate for early diagnosis through genetic testing in young children and in young families. As a patient advocate, we just have to make sure that the mission of ERN-EYE is fulfilled in the interest of patients and patient groups and their organizations.
Okay. And in your opinion, what is the most important issue ERN-EYE could overcome?
Well, there are many, but one might be, whilst thinking globally, we have to act locally at the same time, and this is sometimes very difficult when it comes to implementation of rare eye disease strategies on national levels in our countries. We need the collaboration with the important stakeholders like health ministries and other institutions, because otherwise, if we don't do that, the idea and the mission of ERN-EYE, which is not only promote research to find treatments, but also giving access to all citizens within the European Union. If we don't have this collaboration with our national health authorities, the idea of ERN-EYE would fail, and that would be a shame.
And what are the main challenges of the network, do you think?
Well, besides many, let's say, practical and operational challenges, like the registry on European level, like CPMS, like guidelines, we have also a strategic challenge to overcome, which might be to cover the white spots on the European map, and including those countries which are not in the network yet, to have them affiliated in which institution, whatever. And to fulfill one of the most important missions of ERN-EYE, to give access to expertise to all countries within the European Union.
Mm-hmm. And what are the best advances?
Well, I would say that ERN-EYE is there, that it is reality, that it has been established and that it works and that things are working and that the very dedicated people are there who get things going. So like the efforts and the energy and the dedication that the coordinator and the coordinating teams dedicates to the work of ERN-EYE, and also the HCPs with their time, their efforts and their engagements. And last but not least, the patient advocates and their organizations, above all Retina International, and also their willingness to all together to continue to work to make ERN-EYE successful.
And in your dreams, what would ERN-EYE look like in 10 years?
Well, I have many dreams, but for ERN-EYE, I would say in 10 years, we should have cross-border consultations, cross-border healthcare for every citizen in the European Union. And also, we should have a very strong ERN-EYE network, as a European network, strong and united, to be able to be a global player in the global setting, interesting for international cooperations and collaborations, let's say with the US or Canada or other continents. And all this in the interest of patients with the mission to find treatments, to find cure, and to provide appropriate disease management with all its aspects, not only the medical side, but also the full range of psychosocial and social aspects should be included.
Perfect. Thank you very much.
Thank you. Pleasure.